2020 is a year with horror and desperation. I have to say, we are at war, and the battlefield is in our bodies. The coronavirus can cause a severe acute respiratory syndrome, and we simply call it as the COVID-19. Why is it so deadly? A virus is made of some genetic materials and a few proteins. And once it will spread through the surface. And here are some examples of how you can survive through these surfaces. So let's say, once you cough or touch the surface with virus on it, then the virus will hitch a ride into our stomach. And the virus will start to inject its genetic materials into its victim's membranes. Once the cells will receive the new order, which are copied and reassembled. As more and more coronavirus are produced through the cells, then you will receive one final order, which is the self-destruction. Billions of viruses will be released to attack more cells. However, we have the immune system. As our immune system tries to find the coronavirus and attack them, the coronavirus will also infect the immune cells to make them overreact and start to damage our lung cells. This could be an irreversible damage to our bodies. And once we lost the last barriers and let the bacteria into our blood, death is very likely. There are two features for a pandemic like coronavirus, fast and slow. A fast pandemic starts with a very strong infection rate. Many people get sick at the same time. This could be horrible because there isn't enough medical staffs or equipment like the ventilators for every patient. So people will die untreated. And as more medical staffs get sick, the capacity of the medical system falls even further. So when it comes to this situation, doctors or nurses will have to do bad decisions. Who gets treatment? Who does not? So what should we do? We should turn this into a slow pandemic to make sure that everyone can get treatment. And this simply means four things. First, wash your hands with soaps or wear your masks. Because the coronavirus is enclosed with a layer of fat, the soap will destroy the layer so that the coronavirus will not infect you. And same with the mask. The second thing, go fruit yourself. This is not a medical advice, but it will truly increase our chances of survival with very little risks. So what fruit should we eat? The kiwis. The researchers found that the kiwis is packed with vitamin C and E. And there's also a study found that the kiwi can help the patients to slow down their severity and the duration of the upper respiratory tract infection, 上呼吸道感染. There's also another study of about 200 patients that the kiwis can help them reduce some syndromes. There's also a study found that almost every patient with COVID-19 is exhibit the hypokalemia, 低血矫症. So, what should we do? We need to eat more fruits with the high potassium, which will be the kiwis, yes, the kiwis, bananas, the dragon fruits, and also the avocados. But make sure, do your own research so that there will be no allergies for your bodies. And try to find out whether these fruits may have any conflicts to your bodies. Third, go work out. There is a study of over 400 patients in China found that the obesity was highly associated with the COVID-19. There's also another study in Europe with over 4,000 patients found that obesity was the major high risk factor for the COVID-19. The third, keep the social distancing, which means no huggings and no handshakes. Well, this may sound a little bit not so convenient, but it's worth to do it. If you can, please stay at home and let the people who need to go out for society to functions, from doctors, cashiers, to the police officers. You depend on them, and they also depend on you to not get sick. Quarantines can also buy the crucial times for researchers who is working on the medications and also the vaccinations. So, although we still don't have the vaccines for coronavirus, we can act like a social vaccine, right? There might be a pandemic like the coronavirus in the future, but I refuse to accept that so many people has to lose their lives because they do not have a proper information or because they are lack of money to get a treatment. So maybe these 4 steps may be hard to sustain as a habit in the future for yourself, but it's looking at the big pictures is a small price to pay, as we can help ourselves, our families and friends to make the pandemic into a slow pandemic. So let's give conclusions. We should wash hands with soap or wear your masks and eat more fruits, go work out and keep the social distancing. And once we do this, we can help all our society to work and sustain in the future. Toastmasters.